In case you're just tuning in, you're watching News Today right here on Afia TV. The Trump administration has ordered a halt to the supply of critical medicines for HIV, malaria, tuberculosis, and newborn care in countries supported by USAID, including Nigeria. Contractors and partners working with USAID were notified to stop their work, marking a significant disruption in health programs. Joining me to talk about the impact of this on Nigeria's health sector is Dr. Chioma Odimegwu, Consultant Paediatrician member, Nigerian Society for Paediatric, Infectious Disease, and AMS team, UNTH. You're welcome on the program.
Thank you.
How are you doing today? Happy
Very
Sunday.
well. Happy Sunday and Happy New Month.
I wish you the same. So I just want to get your thoughts on this. What do you think about this?
Oh, well, like every other Nigerian, we think is a rude awakening.
Okay.
I'll say a rude awakening because the program has been supported, like the PEFA, that's the presidential program for AIDS relief in Nigeria, what we call PEFA, that supported HIV treatment, has been in Nigeria for over 20 years. In fact, about 2023, 2024, they celebrated 20 years of supporting HIV care in Nigeria. And HIV care is both treatment, care and support, prevention, both for mother, for pregnant women, children born with HIV, adults living with HIV. All those people access care free, and it's been 20 years of doing that for us. And like every program, we know that we should expect a period where people take ownership of that program. So it came as an emergency relief program initially about 20 years ago, 2003 to be precise. First, it was a 5-year program, then extended to 10 years, and then we saw further extensions. So at the back of our minds, we knew one day Nigeria will have to wake up to own these programs themselves. But I think the thing about it is that it just came suddenly, and I would say that was just a rude shock, but a rude awakening, because we should have been well enough prepared to take over providing care for our people.
So there was no plan at all, because you said we had it in mind. We knew that one day this would stop. So were there preparations? Were there things happening? Were there plans put in place to, in case this happens?
Definitely. Already there's a response that's been put out.
Okay.
The NACA, Nigerian Action Against HIV/AIDS, has already put out a notice to say, Nigerians, calm down. We've got everything in control. So like I said, yes, for every program that is funded, usually these funded programs are tenured programs, maybe 5 years, 10 years, but they may be renewed. So in as much as they are funded programs, the nations being funded at the back of their minds would one day look forward to taking over care and support for your own people. Initially, it's a relief program or an emergency response program. But then the owners of the program, the community, the people take over and begin to build up and take ownership so it can be sustainable. That's how programs are kept running for years. Nobody's going to spoon feed you for donkey years. It's done as an emergency relief. One day you wake up, become strong enough to take over, own the program, and then provide care and support for your own people.
Who is at greater risk of this ban?
I would say, well, everybody is at risk. Everybody is at risk, because when we talk about HIV care, we talk about those that are affected and those that are affected, kind of. You have the people that are primarily affected. Okay, let's say those that are infected, rather. Sorry. Those that are infected and those that are affected. So the infected people are people living with HIV, people that have the virus. But those affected are people that are friends, relatives to people living with HIV. So one way or the other, everybody is affected. Because you may have a friend, a caregiver, a loved one who may have been on medication for a while. And the good thing about this medication, the highly active antiretroviral therapy, is that it suppresses the viral load to a point where transmission is minimal. So you can have discordant couple, a man and a woman living together as husband and wife, where, for instance, either of both parties may have the virus and the other does not, what we call the discordant couple. And that's in most cases achievable because one party is on medication that has suppressed the virus to undetectable levels that transmission can no longer occur. You see, so, but now the risk is that families that may not have access anymore to this medication at no cost, or people that cannot afford it, because all this while it's being free. So the thing is it going to remain free? And if it remains free, it's going to remain available and accessible. Anyway, there's cheering news. I read recently that a concession has been given for very infectious conditions. So, in as much as there's a ban, a concession has been given to drugs that need to be given to people that are at risk. That's highly infective conditions like HIV. So, in as much as, and again, that ban was supposed to be for 90 days.
Yes, at least 90 days.
And 90 days. And the whole idea was just to look again at the program and know, is this what we want to keep throwing our funds into? But then, even within the 90 days ban, recently again, a concession has been given to highly infectious diseases.
So now,
right now, we are still in the window of opportunity to have something going on till March.
So right now, where do HIV patients go to get their medication?
Still at their primary centers.
Okay, there are still medications.
Yes, with this new development right now,
okay,
for those with highly infectious diseases, the concession is available, so they can still get their medication.
All right. It just looks like everything is happening at once. We've heard of the increment by telecom operators. We've heard of, so many things happening in the country. And then this is also happening. What impacts do you think this would have on Nigeria? For the past how many weeks? We're talking about impact, but it looks like we're going through a lot.
Yes, not just Nigerians. I think all over the world.
Mm-hmm.
We heard about the plane crashes that occurred here and there. Even in Enugu State, the accident at Tuberculosis. Exactly. So a lot has happened since the beginning of this year. And there's a lot of emotional trauma, a lot of psychological trauma, then the economic stress, all impacting one person. So I think the impact is enormous, and the government should, as much as possible, step in to help alleviate these problems. Yeah.
So still talking about medications, can Nigeria source these medications locally? Is it possible for us to source these medications locally, or we still have to rely on foreign aid to continue with this HIV treatment and medications?
When you say source locally, are you referring to manufacturing of this medication?
Exactly.
Right now, we don't manufacture antiretroviral drugs.
Okay.
These are drugs that are special classes. How do I put them? They're drugs that you don't want them to be faked. How do I say it? You don't want the fake products to get into the market, because once you have the fake products in the market, you know what that means. It's going to wipe out a lot of people. Nigeria, for instance, has the highest burden of HIV in the whole of West Africa and Central Africa. And then when it comes to pediatric HIV, Nigeria has the highest burden globally in the entire world. So we have an enormous burden of HIV in Nigeria. So Nigeria is not a country where you want pirated drugs or fake drugs in the market. And these drugs have been good, because they're free. Nobody goes pirating something that is free because they're not going to make gain from it. So drugs that are usually faked, or drugs that are usually, pirated, if I use that word, are drugs that are expensive drugs and people are trying to make gain out of them. So when we move away from having them free now to having them at a cost, and we know it's something that someone's life depends upon, it puts the people at risk. So it calls for government policy and government action. I'm sure that NACA, NCDC, and the relevant bodies in Nigeria are on top of it, and very soon we'll be hearing more from them regarding this.
So what are your expectations just as we round off our discussion? Well,
my expectation is that, like I said, I expect a more robust response from NACA, more robust response from NCDC. And like I said, it's a rude thing that just happened. Usually when you want to phase out programs, you give it time.
Mm-hmm.
Like I said, before now, there were expectations that Nigeria is going to take over, owning this program, strengthening this program, and providing care and support. So those are part of my expectation, that in very short distance, we'll have responses from relevant bodies to see how this thing is being tackled. But in the meantime, everybody should remain calm. The drugs are still available. at no cost. And those that need it should please still go ahead and access their medications.
All right. Thank you, Dr. Chioma, for joining us
You're
today.
welcome.